When is it safe for you to drive after a foot or ankle injury? I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist. I help you feel and perform your best regardless of age or injuries. Now, if you've broken a bone in your foot, broken a bone in your ankle, or needed foot surgery, or needed ankle surgery, one of the questions I'm sure you have is, when can I get in my car and drive? Whether it's to school, whether it's to work, or just getting around town. Because you don't want to depend on your parents, you don't want to depend on friends, your husband or wife or your kids to get you everywhere you want to go. That's fine once or twice, but you don't want to ask every day, several times a day for 4 or 6 weeks. So I get this question tons from my patients. And I'll tell you, there's not absolute black and white. So I will say, whatever your specific injury or surgery is, talk to your doctor to find out what you specifically can do. But here are some general things to think about. If it's your foot or your ankle and you're in a cast or you're in a boot, it's probably not safe to drive, if it's especially on your right foot. Now, if you're allowed to put weight on it, but you're just in a boot for walking, maybe you can talk to your doctor about, hey, just for driving, can I take off the boot, bring a normal shoe in the car that I used to drive, and then as soon as I get out, I put the boot back on. The reason that matters is that boot is really clumsy. It is really hard to be able to put, basically your foot's on the gas and then move it to the brake real quickly. That boot's clumsy and you might miss the brake. And whatever you do, you don't want to be in a situation where it's potentially dangerous, where you miss the brake and then you get into an accident. So I think that can be very important. If the same thing goes if it's your left foot or ankle and you have a stick shift, manual transmission, because then you have to push the clutch. So I think that can be very important. But if you're strictly non-weight bearing on that right foot, even if you're in a boot, if you're not allowed to put any weight on it, your doctor may not let you drive. And so that is something that's important to know. Now, I know it's no fun to ask somebody to do it, but then once you get to work or school, then you go on your crutches or on your rolling scooter or whatever it is, you might be just fine to do stuff there, but it's actually being able to slam on the brakes quickly if you need to. So ask your doctor, hey, am I allowed to take my boot off? And then can I bring a normal shoe? Maybe you're allowed to drive at that point. If you're in a cast, my guess is your surgeon's going to tell you, hey, this thing isn't safe. And then test it out before you try it on the main roads. Get in your neighborhood early in the morning. Make sure you can actually press the pedals the way you want very easily. Maybe get into a big store parking lot or somewhere where you've got a lot of space and test out your ability to actually hit the pedals to drive safely before you get out on the main roads. If this video was helpful, click the video below for much more helpful information. Subscribe to my video channel for tons of videos that can help you with your sports or exercise injury or feeling or performing your best. And I look forward to seeing you right here next time.